Hi, I'm Teresa Brown. I think we all know why we're here, and I'm not going to be briefing you so much on legislation as telling a story and giving you some emotional and personal background as to why this legislation is so important. To introduce myself, I'm a working clinical nurse. I work in Pittsburgh. I'm also a writer. I've written a book, and what I'm most known for is I write an opinion column for the New York Times where I talk about nursing and healthcare. It's called Bedside. But I'm here today not just as someone who thinks and writes about healthcare, but as a provider of healthcare, and in the story I'm going to tell you as a consumer of healthcare. So about a month ago, one of my daughters, I have twin daughters who are 14, was having pain that we didn't really understand in her left shin. I finally saw an orthopedist. Oh, she needs to get an x-ray and an MRI. That's fine. So we're waiting first in the waiting room for the x-ray and then in the waiting room for the MRI. And in one of the waiting rooms, we heard an ad on TV for UPMC, and in the other waiting room, we heard an ad on the TV for Highmark. And I can say quite honestly that I found this conjunction of the two ads while I was there with my 14-year-old daughter who was having pain, I didn't understand, couldn't walk very well, very unsettling, because it brought home to me the question of what are we really doing here in our community with healthcare. I suddenly felt very concerned that rather than having what we might call a healthy level of competition to make healthcare as good as it can be, we flipped over into an area where healthcare had suddenly become more about market share and competition than about the patient. My focus that day was obviously my daughter, who got the MRI. She's in a boot, which may come off today, so she did get taken care of. But it was a very unsettling moment, and the concern for me was, are there any brakes on this train the way it's going? So I look at this legislation as a welcome break so that we can return the focus to healthcare in Pennsylvania to patients and their concerns. And now I'd like to introduce Representative Jim Christiana.
Good morning. As many of us know, the healthcare climate in America is changing every single day. Along with rapid changes comes uncertainty and even fear. On the national front, the implementation of Obamacare has left millions of Americans with unanswered questions about their health insurance option and how it will affect their relationship with their doctor. In addition to these changes, rapid consolidation of hospitals and doctors' offices across the country and across Pennsylvania is adding to the uncertainty. Every week, it seems, a local community hospital or a doctor's office is gobbled up by a conglomerate healthcare giant. Compounding this culture of fear are the multi-million-dollar ad campaigns that are bombarding Pennsylvanians. Ads that are threatening to restrict the access of their facilities to some. And while we may not be able to completely control the evolving healthcare landscape, we can ensure that Pennsylvania citizens have a modicum of certainty about their family doctor and their hospital. In our Commonwealth, hundreds of thousands of people are on the verge of being forced to find a new doctor or a hospital. They're on the verge of having to change their doctor or hospital because of the logo on their insurance card. And it's time we step in. Pennsylvania is blessed with some of the best healthcare networks in the country, some of the most innovative care, some of the most talented doctors. These institutions benefit from a tremendous amount of tax-exempt status that saves them hundreds of millions of dollars a year. These institutions have benefited from tens of millions of dollars from taxpayer subsidies. And to think that these same taxpayers that help build these institutions and facilities would be restricted from these state-of-the-art resources because some healthcare giants have decided to leverage access to gain market share, to me, is completely unacceptable. We should never have to live in fear that our care providers will lock us out, not because of a lack of insurance, but because of the logo on the insurance card. As Representative Frankel knows, I am the first to criticize government for putting its nose where it doesn't belong. Too many politicians believe that our problems lie in the creation of more government and regulation and control. However, I am convinced that the consolidations of hospitals and doctors' offices and the power of large healthcare providers demands that the government put safety nets in place to protect the interest of all Pennsylvanians, who either now or in the future will be affected as they seek affordable medical care of their choice. We must protect the access for our constituents. If some of our nonprofit hospitals cannot act in the best interest of the patients they were created to serve, then the General Assembly must act decisively, responsibly, and in a bipartisan fashion to address this critical issue. We know that consolidations will continue to accelerate as hospitals and doctors' offices adapt to the changing healthcare industry. If the appropriate checks and balances are not put in place, patients will continue to be leveraged and threatened as conglomerates seek to run the table. They seek to drive out competition. And in my opinion, it's unacceptable. For these reasons, Representative Frankel and I are introducing House Bill 1621 and 1622 to begin to address the issue. This legislation will ensure that no dominant healthcare system will have the ability to shut out an insurance company and thereby restrict the access of its customers. It will protect and encourage competition that will result in lower cost, higher quality services, and innovative approaches to delivering care. It will prevent an integrated health network from demanding unreasonable rates for services. If a mutually agreeable contract cannot be reached, this legislation will impose a contract on the parties through mandatory binding arbitration. The arbiter will be tasked with putting a default reimbursement rates in place until an arbitration award will be met. This is to ensure that patients will not lose access or have their care interrupted due to executives being unable to reach a contract. With this legislation, we have the opportunity to put Pennsylvania at the forefront of addressing an important health care policy. Not a regional health care problem, but something that is happening all throughout the Commonwealth, all throughout the country. Consolidation is only going to become more prevalent, and the need for this legislation is only going to grow over time. It's my privilege to introduce the co-author of this bill, Representative Dan Frankel.
Thanks, Jim. As Jim implied, it's a kind of an unusual duo introducing this legislation today. We certainly, as he indicated, probably have different worldviews on many issues. But with respect to this issue and the importance that it has, not just for Western Pennsylvania, but as Jim said, for our entire Commonwealth, as the trends towards consolidation, the trends towards creating these integrated delivery networks where you have large healthcare systems also having insurance plans as part of it, is something that I think the Commonwealth needs to get in front of. And as Jim said, this is about access. We as a community built these hospitals. We built them with our tax dollars, our premium insurance dollars, our charitable donations, and even with government grants. Hospital administrators can't use that benefit to then decide who they will and will not accept money from and limit some consumers' ability to access the hospital. Everybody deserves to access these hospitals. I believe that it is important for all hospitals, but I think it's particularly important for certain hospitals, hospitals in rural areas, specialty hospitals, and those hospitals like Children's Hospital that every family wants and deserves access to, but which our community simply can't afford to replicate. It is also about strengthening our consumers. As anyone who has had to receive a procedure knows, consumers are bearing a bigger share of their health care costs. The most recent report from the Healthcare Cost Institute found that out-of-pocket spending grew faster than even what the insurance companies are paying. In fact, patients are paying more than 16% of all healthcare costs out of pocket today. For better or for worse, most healthcare analysts believe that's a trend that's here to stay. So I believe that the other important issue here is choice. In this new world of healthcare insurance, we expect more of patients. We want them to be savvy consumers. That means they need the tools to be able to hold down their own costs and get the best care. I would argue that right now, not only are we not providing those tools, we're allowing hospitals and insurers to hide them. Patients have no idea how much their medical care costs, even though they're paying a percentage of the cost straight out of pocket and even a larger chunk out of their salary. So if a patient wants to use a high-value health care provider and save themselves some money, they have no way to do it. Our legislation does a few important things. It ensures that the executives of any hospital with an affiliated insurance company can't use the hospital's power as a service provider to control how health care is financed. It makes sure that doctors that are affiliated with hospitals also have the ability to accept those other insurance cards. It prevents onerous non-compete clauses with physicians who found that they have to leave the county if they want to keep working. And it makes sure that these hospital executives can't prevent tiered products. This is important because that means they can't prevent an insurance company from letting consumers pay less to use the services of a less expensive, high-quality, high-value hospital. We need to make sure that healthcare competition thrives in Pittsburgh and around the state. And we need to make sure that cost and quality information are made available to the public. At the end of the day, there seems to be two routes to controlling healthcare costs. In some places, government simply sets the rates and decides how much doctors and hospitals get paid. And we see that in the state of Maryland, actually. The other route is competition. In competition, providers should be competing to provide great care at a cost our community can afford. That's the route we've chosen for private health insurance. But competition just won't work if hospital executives are telling us what they demand to be paid, and we as consumers have no ability to make any choices about whether or not we're willing to pay that. I believe our legislation is the first step in making sure we preserve real competition and give power back to consumers. Thank you.
As I mentioned, consolidation of hospitals and doctors' offices is very prevalent throughout this Commonwealth. This is not a regional issue, in my opinion. This is a Commonwealth issue that affects all of our districts and all of our constituents. To give a little bit of a perspective of how this isn't just a Western Pennsylvania issue, I'd like to introduce my colleague, Representative Mike Fleck.
Thank you. I represent the 9th largest district, House district in the Commonwealth, spreads over 3 counties. And I have 3 really great hospital systems. My community hospital in Huntington is currently in negotiations with a merger deal with Pinnacle. I come within 5 miles of Altoona. I have a portion of Blair County, and Altoona Regional, which is our largest hospital, is no longer Altoona Regional as we know it, as it is merged with UPMC. I also represent half of Mifflin County, and Mifflin or Lewistown Hospital has just merged with Geisinger. I just want to make sure that my constituents have access to health care. We have enough hurdles to overcome in rural areas, and we need to know that if we go to a J.C. Blair and they can't help, that they can go right up the road to Altoona or to Lewistown, as they've been doing in years past. And I agree with Representative Christiana. I'm not a big government intervention person, but when it comes down to affect my district and it's going to have a negative effect, you betcha I'm going to get in there. So I thank this duo of gentlemen who usually are on different sides of the aisle, and I'm probably somewhere in the middle between the two. So thank you.
And now we'll hear from another nurse, Paula Stellabot, who is at the newly formed UPMC Altoona.
My name's Paula Stellabot, and I've been a registered nurse for 23 years at Altoona Hospital, which is the only major hospital in Blair County. Roughly 70% of the patients that I see every day have Highmark insurance, but that has never meant anything to me because as a nurse, my first and only priority has always been to ensure the patients that I see get the best possible care, not what insurance card they carry. Earlier this year, as Teresa said, we found out that UPMC would be taking over our community hospital effective July 1st. Soon after that, UPMC announced its decision to end its contract with Highmark at the end of next year. With so many of us on Highmark insurance, people are scared. For many of the patients I see, UPMC's decision could mean they lose access to a hospital and doctors that they know and trust. It could also mean that they'll be driving hours for procedures and checkups that they should have access to in their own backyard. My colleagues and I at UPMC Altoona are proud to be part of a nationally recognized network of hospitals, and we look forward to continuing to provide the best possible care for our patients. But what good is it if our own community isn't allowed in the door? Our not-for-profit hospitals are community assets. Taxpayers built them, taxpayers subsidize them, and taxpayers should have to have access to them. If the executives who run these institutions are allowed to pick and choose what patients they see, we are permitting the system to fail us. We can't have a healthcare system that guarantees continuity of care, openness, and efficiency as long as our biggest hospital systems are able to choose to contract with our insurance companies only when and where it suits their bottom line. For the good of my patients and my community, the legislature needs to act quickly to ensure that patient choice is protected and our hospitals are open to everyone. Thank you.
We'll take some questions from the press only. Yeah, Brad?
Thank you. Is there any precedent anywhere in the country, in other states, particularly for the binding arbitration portion of this in private industry?
Not to my knowledge. There's not an example I can point to. But I will say that this is something that is going to continue to be talked about as healthcare landscape continues to change, as more healthcare systems, as more providers start their own insurance plans. This is going to continue to be a problem, and I think this is where Pennsylvania could be a leader.
Right, the fact that you don't know of any, maybe there aren't any, but if there aren't, and this is the only one, doesn't that increase the likelihood of litigation? That this will go on for a couple more years in court?
I don't think we can't be concerned about that. It shouldn't be used as a stall tactic. I think that's even more important. While this contract is that we are discussing, specific contract we're discussing, isn't set to expire until next year, I think that's why the legislature should act decisively, and we shouldn't, let the clock run down to the fourth quarter. I think we need to give some continuity and predictability. That we're not going to, and that's why I also think this is a long-term solution. As you know, last year the House passed a similar proposal which led to an extension of the contract. That while that was a successful short-term fix, I think this bill provides a much more long-term solution rather than short-term fixes. If you have something down.
Care to comment on that?
Well, I think this has been a new trend. I mean, the whole creation of this new kind of both provider financing mechanism of a integrated delivery network is something that that is really only in the last several years become prevalent and more prevalent around the country. I mean, UPMC started its own health plan, and now you have a health plan, Highmark, acquiring a health care system. So it's something it's kind of new, and in terms of our experiences with it and the implications for the cost of health care and access to health care, these are questions that I think are just coming up and popping up. So this is a new approach to addressing it, and I think the legislature has a role to look at how this is going to affect our communities, how it's going to affect access, how it's going to affect the inflation and the cost of care, which has been quite dramatic. And one of the things that we're really seeing around the country is that the cost of health care is exploding. Right now, we spend about 17% of gross domestic product on health care, projected to be at 20% of gross domestic product at the end of the decade. And what are we getting for that? Because when you look at the rest of the world, the rest of the developed world is spending 10%. They have longer life expectancy. They have less chronic illness. They have lower infant mortality. They're getting higher value, better quality for less cost. And what we've seen, particularly in many parts of the country, including Western Pennsylvania, is that provider leverage is one of the key components when you take a look at the rising cost of health care. And that's one of the issues that this legislation addresses by really saying that we need to have competition among providers. We can't let them kind of close their network and create really almost a monopoly in where they can manipulate the price by manipulating the reimbursement system. So the tiered products that are part of this, that are mandated that they'll be able to offer, create that kind of competition. Now, I listen to lots of discussion from some of these healthcare systems say, well, we want competition among insurers. Well, insurers have a limited ability to inflate cost. I'm not saying that historically insurers have been angels in this process, but under the Affordable Care Act, insurers are constrained how much they can charge for a policy. 85 cents of every insurance premium dollar has to be expended on health care, otherwise it gets rebated to the business or the individual consumer as it did last year. So it's the underlying cost of providers that look to making insurance premiums go up. And that cost is basically driven by providers who have enormous leverage in the healthcare system. So you see manipulation. You see when providers go out and buy up a physician's practice, that practice now becomes an outpatient facility. It inflates sometimes double or triple the cost of a procedure. Procedures are moved around from a general hospital to a tertiary or a specialty hospital where they command higher prices. So there needs to be some check and balance, and I think this legislation helps to address that issue.
What is your time frame for when you would like this passed and moved over to the Senate?
I think that'll be controlled by how quickly it gets a committee vote. I think that an issue as important as this deserves a vetting process, but this is something we did talk about in the last session. We did have several hearings with multiple executives from integrated delivery networks testifying at length. I think it's one of the most important issues to the Commonwealth. I think it's the most important issue that's not being discussed is the ramifications if these contracts aren't extended and they are set to expire. And the constituents are continually becoming more and more aware of the situation and, in my opinion, have continued to increase their demand for government intervention in helping put some predictability in place.
Could you have another hammer and attempt to strip one of these hospitals of their nonprofit status or the insurance company if you don't get that?
I think we need a responsible approach to this. I think this is a 8 and a 9-page bill. It's not terribly complex. Some folks have went after that hammer. I don't believe it's the responsible approach. I think this process needs to be responsible. I think these are legitimate nonprofits, but I think that means that they should have the constituents should have access to them. And so that's not my focus. Clearly, that's not the focus of the bill. I know that's the focus of some. I'm not in support of that path.
Is this bill substantially the same as the one from last session, or are there new features, new elements?
I don't have a compare and contrast. I know it's, roughly speaking, it's very similar in trying to accomplish the same goal.
I mean, it is a little broader because it does talk about insurers being able to offer products that will create competition in the provider marketplace. You know, it does mandate that the tiered products be allowed to be offered by insurance companies that can offer, as I say, low-cost, high-value healthcare insurance. That is one of the differences in this bill because that helps to address the cost side of the equation, which I think is also part of it. So this legislation addresses both access and cost and looks to seek to obviously maintain the access that everybody wants, that they're not going to be discriminated against on the basis of their insurance card, that we're not going to disenfranchise our citizens from their doctors and their hospitals. But it also is going to say that we also want to constrain the healthcare system from the excesses that we see that inflate our cost of healthcare in my view, in an irrational way, and that we're going to create real competition between providers, not just between insurers. And that's really important. You have to have access to everybody in order for there to be genuine competition.
There's no apparent connection here, but do you believe any of the concepts in Obamacare, whether that's the insurance networks or whatever, would have any bearing on how people perceive this? Or
I do think so, because under the products offered under Obamacare you have different choices in terms of what you can buy, and many of these products, in fact all the products, have significant amount of cost sharing involved in it. So the consumer has more skin in the game. The consumer is going to want to have more say about and more input with respect to where they get their health care, because they're going to be more concerned about looking at value, that is cost and quality. Up until now, it's been, pretty much most folks don't really care. They don't have a vested interest if they're getting, you have small deductible or no deductible or no cost sharing involved. The consumer doesn't really have skin in the game. Now, for better or for worse, consumers are getting more and more invested in terms of where they're going to be getting their health care, because they're going to be sharing more and more of the cost.
people who already have insurance won't be in the exchanges. So,
Well, but those products are also changing. So other products you're seeing today on renewals include higher deductibles, higher co-pays, more cost sharing. And more cost sharing means that consumers are going to be much more discerning about where they buy or they get their health care provided to them from. And in order to have that real competition, there has to be access to all providers.
The Obamacare bill was aimed at the insurance companies. Is this and I'm from the eastern side of the state, so is this like who's more at fault in your opinion? Let me just get to that. The hospital or the insurance company in this fight?
Well, to be honest, these integrated delivery networks are in both businesses. They have an insurance plan, and they also are providers. I'm not interested in blaming fault. I'm proud of the healthcare networks that we have in Pennsylvania. We have some of the most talented docs. We have some of the most talented nurses. We have community hospitals that are very important to local areas like my own. So I'm not interested in fault. I'm just interested in making sure that all of our constituents can utilize some of the best healthcare networks in the world.
And look, some people may think that we're trying to decide winners and losers in this, but ultimately I think what we're dealing with is a healthcare landscape that we want to see work. And in order to make it work, you need to have access, and you need to have transparency with respect to costs, and you need to have some ability to have real competition. And you'll hear probably later today from from some of the providers that they believe that that what we're trying to do is limit competition. They want to bring in all these insurance companies. We say bring them all in. Bring in the Aetnas, bring in the Cignas, we're not trying to protect Highmark. We want everybody to compete, but we think everybody ought to compete on the same basis and have access to all providers. And that is the healthiest form of competition, because it's not just competition between insurance companies, it's competition between providers who are directly kind of being held accountable by other providers, I think, in terms of their costs. So you can't see the kind of enormous gaps or discrepancies between, a procedure at X hospital and Y hospital, that may be 2 or 3 times the cost, that there will be some corrective mechanism there to check, I think, what are clearly been excessive abuse of the reimbursement system to inflate healthcare costs at the expense of our community and our consumers.
If I can I just add one thing? I think this bill aims to preserve competition. I think the concern is that with these conglomerates that are in both the insurance business and the provider business, that they're able to leverage their facilities. Because, to be honest, people want to go to their doctor. They want to go to the most world-renowned children's hospital in the country, and we should allow them to have access to that. I believe this is preserving competition. This is saying if there's a willing insurance company out there, we're not going to this bill is saying we're not going to allow you to be locked down. If you have a better product, a lower cost product to offer to businesses and consumers in Pennsylvania, bring it. Because in years past, they've been locked out. There was exclusive deals. I think that added to the rise of healthcare costs, and I don't think that is in the best interest of our constituents. I want access for everyone, but I also want competition on the provider side and the insurance side. That will result in lower costs, increased quality, and hopefully more efficient delivery process of healthcare.
One final question from me. Part of my ignorance on this, but is there any mechanism within state government, either the state insurance department or the attorney general, that can create this kind of, can do, already do what your bill wants to do?
Well, the Attorney General has, has a say in terms of, particularly when you see the consolidations taking place. So I know for a fact right now that the Attorney General is looking at 6 consolidation transactions now in the state. I mean, they were involved also in the Altoona UPMC case, which ultimately mandated that the Altoona UPMC Altoona now provide access to Highmark policyholders. And I would say to folks that if it's good enough for Altoona, it's good enough for the rest of Western Pennsylvania as well. But the Attorney General has considerable say. I know that they have looked at issues of antitrust issues, how funds that are deemed used for public charity are being deployed. Those are things that I think the Attorney General's office takes a look at and is ongoing in terms of, particularly as we look at this continuing trend for consolidation in terms of healthcare and among providers.
Is this legislation primarily intended as leverage to get them together on a deal, or do you really want to see these provisions take effect?
I feel like from the media campaigns, some board decisions, forcing these two, hoping that these 3 at the time get together and find a way to work together is probably unlikely. It seems as if at least one in particular is dug in, that they want to see the contract expire. This is the path that they want to go down. And I'm not, as I mentioned, I want a long-term solution that grants access to all Pennsylvanians to these wonderful facilities. Kicking the can, to use a phrase, kicking the can down the road, I don't think is responsible. It's definitely only going to provide predictability for a short term. That's why I think passing this bill and getting it to the governor in a timely fashion is is the most responsible approach.
Look, I think this is not just about Western Pennsylvania. It's not just about Highmark and UPMC and Allegheny Health Network and the UPMC Health Plan. This is about a trend that is taking place and will continue to take place. We have 2 independent integrated delivery networks in Western Pennsylvania. We have another one in Geisinger in the middle of the state. We have Thomas Jefferson looking at doing it in Philadelphia. This is a trend that's taking place alongside with the consolidation of hospitals, of physician practices, and if it's not in your neighborhood now, it's coming soon. And so I do think that this legislation is more than just a tactic in terms of trying to resolve this one dispute. It is about trying to get in front of a trend that this entire Commonwealth and, in fact, this entire nation is going to be dealing with in the future. Consolidation is, among providers is not necessarily a bad thing, but it needs to be controlled, it needs to be managed, and we need to ensure that there is still competition and accountability with respect to both the cost and the quality, the value of the health care that we're receiving today. And unfortunately, that's not what we're getting right now. And one of the things that's interesting, and you listen to all the advertisements that Jim talked about that we're being bombarded with that I think are, distort this discussion. But we do have a problem here in Pennsylvania with respect to quality and cost. And if you take a look at the Pennsylvania healthcare cost containment numbers, which evaluate the cost of every procedure by each hospital and then give you a determination in terms of outcomes based on readmission rates and length of hospital stays, you'll see some surprising information. You'll see an extraordinary disparity between hospitals in terms of the cost of each procedure, and then you will see, surprisingly, that typically the higher-priced provider is rarely providing a better quality product at the end of the day, that they're either the same or sometimes inferior. So take a look at those numbers. It's an interesting process that is the one mechanism that we have some transparency around here, but it kind of gets through the advertising to tell you, that we have some issues here in Pennsylvania. We have issues with respect to cost. We have issues with respect to quality. We have, and we've got to get in front of it. And this bill is part, I think, of an answer to that.
Do you have anyone in the Senate who's interested in this, going to carry similar legislation forward?
I don't want to speak for any individual senators, but I know that there's quite a few senators that are aware of the problem. I know that Representative Randy Vlahovic was the prime sponsor of the proposal that passed overwhelmingly last session, and he's now in the Senate. But I don't know of any companion legislation, but I've heard that it could be in the works. Anyone else? Brad? Good? All right, thank you very much for coming.